Hi, this is Dr. Karen Becker, and today we're going to discuss Addison's disease in cats. Addison's disease, also known as hypoadrenocorticism, is a disease of the adrenal glands. It is much more common in dogs than in cats, but it does sometimes occur in kitties. In Addison's disease, the adrenal glands produce fewer corticosteroid hormones than the body requires. The adrenals produce the hormones responsible for the fight or flight response, which is how an animal's body copes with potential danger or stressful events. These potent stress hormones are designed to be produced in small amounts only when the body is being threatened. But sometimes the adrenal glands become overworked and can no longer produce all of the hormones that the body is asking for. If the adrenals continue to underproduce stress hormones, adrenal insufficiency, otherwise known as Addison's disease, develops. When Addison's disease occurs in cats, it's usually caused by atrophy of the adrenal glands caused by an autoimmune problem in which the cat's immune system begins attacking its own tissues. Other suggested causes of Addison's in cats include use of corticosteroid drugs, cancer, trauma or mineralization of the pituitary gland, internal hemorrhage, infection, and granulomatous disease. Kitties with Addison's may not show any obvious signs of illness. When they do, the symptoms can be fairly generic and can come and go for no apparent reason. They include weakness, lack of energy, loss of appetite, increased thirst and urination, vomiting, and sudden collapse. And the sudden collapse is actually fairly common. So you have a kitty that is kind of lethargic and sluggish and then just can't get up at all. You need to be thinking Addison's. Their levels of circulating electrolytes, such as potassium, sodium, and chloride, become imbalanced, which can lead to dehydration and other serious problems. These symptoms are typical of many other feline diseases, and since Addison's is fairly rare in cats, it often goes undetected as your veterinarian is searching for other more common causes for your pet's illness. Hopefully your vet has Addison's disease on his or her radar as a potential cause of your kitty's symptoms. After taking a history and completing a physical exam to look for clinical signs like dehydration, a weak or slow pulse rate, irregular heartbeat, generalized weakness, or depression, your veterinarian will probably perform a complete blood count and serum chemistry profile along with a urinalysis. These tests can tell a lot about the function of your cat's organs, but alone they don't confirm the diagnosis of Addison's disease. Based on those test results, your veterinarian may also recommend some chest x-rays or an abdominal ultrasound or some other tests to try and determine what's wrong with your cat. The confirming test for Addison's disease, however, is an ACTH stimulation test. In this test, blood samples are taken before and after the cat is injected with an adrenal stimulating hormone. If your cat does not have Addison's, the blood cortisol levels will increase. If she has Addison's, there will be no increase in blood cortisol, which is the confirming diagnosis. How aggressively your cat's illness is treated will depend on her clinical status. Acute Addisonian episodes are true emergencies that require immediate veterinary intervention, sometimes even before a diagnosis is confirmed. If your cat is very sick, she will need to be hospitalized to receive IV fluids and cortisol replacement agents. While dogs oftentimes show good improvement within the first 24 hours after initiating treatment, sometimes kitties don't respond that well, and it can be actually 3 to 5 days or even longer after the treatment begins before you could see improvement. Once your pet's fluid levels are normalized and hormone levels are stabilized, and she has received initial fluids and medications, including sometimes IV glucose, and once she's recovered from any other adverse events from her Addisonian crisis, you'll be able to take her home. Long-term management of Addison's disease usually involves oral supplementation with adrenal corticosteroid replacement hormones for the rest of your cat's life. Addisonian kitties should have regular urine and blood tests to monitor the level of adrenal hormones in his or her system, as well as checking other substances like electrolytes circulating in their bloodstream. If elevated potassium levels persist, sometimes additional medications are also required to manage this. Preventing all forms of physiologic stress can help your cat avoid adrenal gland problems in the first place. Start by reducing nutritional stress with a balanced, species-appropriate diet that is moisture-dense and grain-free. Don't allow your cat to be over-vaccinated, as this is tremendously stressful to the immune system and can set the stage for an autoimmune reaction in the first place. Reduce or eliminate environmental stress by enriching your cat's environment. There are a number of ways to do this, so please refer to my videos and articles on the subject here at Mercola Healthy Pets. Keeping a regular schedule that minimizes risk for sudden changes or other unexpected stressors is wise for all kitties, but is especially important for Addisonian kitties. Talk to your holistic veterinarian about glandulars to nourish your kitty's adrenal glands, as well as adaptogenic herbs and nutritional support that might be beneficial. At my hospital, we use whole food supplements and adrenal glandulars to help reduce the amount of drugs needed to manage Addisonian patients, as well as a homeopathic preparation of cell salts called bioplasma, which helps regulate electrolytes. And finally, make sure that your cat is getting some exercise and playtime each and every day, which will help supply healthy cortisol levels to the entire body.